Okay, so then the questions are, what are correct fasting insulin levels? I can't seem to find a consensus on that answer anywhere. And secondarily, what are your thoughts on the ketogenic diet for insulin resistance? So we'll start with, what is the optimal zone there for insulin levels?
Well, you and I have talked before about the normal range when it comes to blood marker testing, biomarker testing, and then what I consider to be the optimal range. So, for instance, if we start first with glucose and then start talking about insulin, we know with glucose that your fasting glucose should really be somewhere around 70 to 85 milligrams per deciliter. Now, the normal range that I was always taught is 70 to 99. Mm-hmm. Above that, 100 to 125 is the pre-diabetes range. 126 or higher is in the diabetes range. So I don't want to be in the normal range. I want to be in the optimal range. So when I discovered that my fasting glucoses, which were similar to yours, when I discovered in my mid-30s that they were in the 105, 110, 115, 120 range, I was shocked. No one was tracking this. I found it on my own. And I realized that prediabetes is a pretty serious issue that we want to consider. And I'll layer in the insulin in just a moment. But I just was looking at some data showing that if you have prediabetes, which you and I have both had, and we both have reversed, if you've got prediabetes, it's a state in which your delightful pancreas, which has these islet cells that produce insulin, are ill. So you get about an 80% loss of function of the islet cells in your pancreas when you cross over into a diagnosis of prediabetes. 80%! It's a lot higher than I ever thought it would be. But you've experienced this too. So tell us about your glucose, and then we'll get to insulin.
Yeah, so I had a lot of the symptoms of insulin resistance and high glucose without really knowing that I was pre-diabetic. And I'm probably not alone in that
For
regard.
Sure.
I've read statistics that now in America, 50% of adults are either diabetic or pre-diabetic. And in that pre-diabetic cohort, about 90% of those people don't know that they're pre-diabetic.
90%.
90%.
It's enormous. We have to change that
100%.
Starting today with this podcast.
Yeah. And so I had all the most common, boring, prosaic symptoms, brain fog, chronic fatigue. I had these weird little brown tags starting to form. Skin tags under my arms.
Yeah.
I've seen them on the back of people's necks too. Sometimes those raised little brown bumps.
Sometimes acanthosis nigricans, which is the discoloration, kind of the velvety color.
Yeah, exactly. And so,
wait, can we finish that list? Because I think this is really critical.
Yeah.
So did you also have carbohydrate cravings?
Absolutely. Carbohydrate cravings. I was chronically insomniatic. I had what I call like dad bod, So I had a nice little, muffin top there on my jeans. I call it my epigenome because it sits there right above my jeans.
We might need a separate podcast just on the dad bod.
The dad bod, right. Well, yeah, let's cubbyhole that. I had some other, I would say maybe female sexual secondary characteristics that we could talk about on another episode. And trying to think what other symptoms, but I guess I would say is that these symptoms were so common and so kind of boring and, not completely debilitating, but very I was just kind of limping through life, but it was so easy to just attribute it to well, I just kind of am a little off today, or I got a bad night's sleep, or, there's just so much stress at work and I'm overworked, all those things also being true. But I didn't really realize where I was until I put on a continuous glucose monitor. And
That's
that
right.
was like a bucket of ice water, non-deliberate in that case, over my head. And yeah, I was running, levels, fasting glucose levels of 125 milligrams per deciliter, and then postprandial spikes all the time north of 200.
Yeah, so you were right on that precipice heading toward diabetes.
Mm-hmm.
So to make the diagnosis of diabetes, we're looking for a fasting glucose of 126 or higher. You can also look at it from the perspective of hemoglobin A1C.
Mm-hmm.
So normal hemoglobin A1C is 5.6% or less. Prediabetes is 5.7 to 6.4. Diabetes is 6.5% and higher. And really, I think a better way to diagnose it is to do a 2-hour glucose challenge test. And my preference always with a 2-hour glucose challenge test is to collect both glucose and insulin. So you mentioned some of the symptoms that I think are so common with prediabetes, with insulin resistance. And then there are these biomarker tests that we can do as well. So let's talk about insulin for a moment. And I just was asking you about your insulins. And yeah, what do you have to say about that, Jeff?
Well, I'll be publicly embarrassed here that I don't actually really know. I do know my blood glucose levels now because I happily wear a continuous glucose monitor, and I have had the normal panels that are done by your primary care physician that do look at hemoglobin A1C. But I haven't gotten my insulin test, and I know, and I requested that from my doctor, who's cool, actually. She's a cool doctor. She's not like some old, white-haired dude, And she was kind of like, I don't know. I mean, your hemoglobin A1C is fine, and, you wear a continuous glucose monitor, so, I don't really think that that's a necessary test because it's generally, at least it's not included in her battery of labs.
Yeah, so I appreciate her, and I totally disagree.
Yeah.
So what we know from epidemiologic studies is that glucose changes relatively late in the process of insulin resistance. So maybe we should define that just briefly. How would you define insulin resistance?
Well, insulin is a peptide hormone largely tasked with ushering glucose to the cells for the use of energy production. And over time, in the presence of a lot of glucose, your pancreas has to produce a lot of insulin. And
the beta cell.
The beta cell, right? And in the body, I will say this as a general comment, the excess of any one molecule will create a resistance to itself.
Yes. It's kind of a golden rule of physiology and homeostasis.
I know that by analogy with tequila and coffee. But so your cells become insulin resistant, and without getting too technical, they shut the front door on glucose.
Shut the front door.
Yeah.
Yeah, so beautifully described. I think of it as, your cells become numb to the insulin signal. I like to use the bouncer analogy at a club where you've got insulin kind of standing at the door of the club, letting people come in and come out, just like glucose. And if you've got a bouncer that is not working properly, you're going to have a lot of people in the street that are just not making it inside the club, inside the cell. So insulin resistance was something that I really struggled with in my 30s, maybe even dating back to my 20s, and I didn't know. And just as you assumed, I thought that the fatigue, the difficulty as a result of insulin resistance with my body having the kind of energy that I needed for my mission, that gap that I was experiencing, I think most of it was insulin resistance. So insulin changes 7 to 14 years before the glucose signal changes. So we know that from the Whitehall study that was done in the United Kingdom. And so you want to be looking upstream from these glucose changes. I wish that we could measure insulin continuously, but we don't have that technology right now. And so when it comes to insulin, when I was in my 30s and I had many of the symptoms that you're describing, fatigue, carb cravings, just feeling like I was pushing a rock up the hill to accomplish my daily activities. I went to the lab and found that my fasting glucose was 105, 110, and my fasting insulin was about 25 to 30. And I was surprised. So that was outside of even the conventional medicine so-called normal range, which is really 2 to 20.
Right. Yeah, it's interesting because so much of medicine has been focused in relationship to diabetes, has been focused on type 2 diabetes. So the presence of lots of insulin, like hyperinsulinemia. Well, let me rewind there. Is that high glucose levels can appear in both type 1 and type 2 diabetics.
Yes.
But there is a huge difference in terms of the amount of the serum insulin between type 1 and type 2 diabetics. So we focused on the glucose, but the story is actually really the insulin, right? And so, like you say, it's just been, glucose is a relatively large molecule, as I understand it, C6H12O6 or something. And insulin is a very small little molecule. And so it seems to be more difficult to test for, but certainly there's plenty of testing that one could do for it.
It's
right?
pretty easy to test.
Yeah.
But I was taught not to measure it when I went through my conventional training. So I'm not blaming conventional physicians, but I found that testing insulin is incredibly informative. And so what I've learned is that the normal range is 2 to 20. The optimal range is really somewhere around 2, 3 to 6.
Yeah.
Hey, thanks for watching. If you like this interview from the Commune podcast, then click subscribe and check out this video right here.